Good morning. My name is Dr. Larry Montgomery with Montgomery Chiropractic in Belton, Texas. And one of the things I hear about a lot is patients or people on the street that I meet will say, I have degenerative spinal disease, you can't help me. And I immediately ask them, why can't I help you? And they will tell me that their doctor said nobody could help them. Well, number one, most people don't understand what degenerative disc disease, degenerative joint disease, or spinal degeneration really is. And so in just a couple of minutes today, I want to show you what happens in the spine and why it degenerates and why chiropractic care is the number one choice for restoring function to your spine. We see here a model with two vertebrae and a disc. Now this is a healthy disc, and you can see that this disc has three functions. It's a shock absorber, it allows movement, and it's a spacer for the spinal nerve that comes out. Now if I hold that real close to the camera, you can see that in a normal situation, the opening around the nerve is 5 times larger than the nerve. But what happens is, for reasons that we don't know, after the age of 25, we lose the blood supply to these discs. As a result, if a vertebra gets misaligned, and as a result of the misalignment does not move properly, that causes the disc to begin to wear out. Now, the only way after age 25 that discs get nutrition so that they can stay healthy is if they have this proper movement. But due to knocks or jars or blows or short legs or scoliosis or some mechanical reason, vertebrae get misaligned, and as we said, this limits the movement. When that occurs, this disc begins first to dry out, and eventually, if given enough time and that misalignment persists, we see how the disc gets much smaller, and as a result of that, the body says, I have to stabilize this joint, so it begins to put bone spurs in there to try to fuse that joint together. So what's the solution to degenerative disc disease? Well, number one is prevention. If from a young age we make sure that there is good movement in the spine, that gives you the best chance to have a healthy spine. But let's say you're already into this degenerative condition. This is what we would call phase 2 degeneration. Then the best solution is to put as much movement and function back into these spinal joints as possible. When we do that, we restore nutrition to the disc, and the disc actually can heal from the inside out. Now, if you're in phase 2 degeneration, am I saying that you come in to see the chiropractor and we're going to get you back to normal? No, I'm not saying that at all. But what I am saying is if we can slow down or stop the degenerative process, restore function, and relieve your pain, then we make your life much, much better. And this is what chiropractors specialize in, is restoring function and movement to not only the spine, but to all the joints in your body. If you have more questions about degenerative disc disease, degenerative joint disease, or spinal degeneration, call us and let us talk to you and schedule a time, and we will do a consultation at no charge. If we feel we can help you, we will tell you. And if we see that you're a case that is past the time that we can help you, we'll get you to someone that we feel can help you. Thank you again for listening about spinal degeneration, and please know that unless you've tried chiropractic or consulted a chiropractor, everything has not been done for your condition. Thank you again. Have a great day. Call us soon.